Okay, so the real secret, or the secret to lower back pain, realistically. So I mean, you could say there's two secrets. One is one I frequently talk about, which is taking the time to understand your injury mechanics before you jump headfirst into a rehab program, and actually understand what you're trying to do before you start doing things randomly. That's probably a big secret, but before you even get to that, and it's one of my bugbears with things like the term non-specific lower back pain, which just irritates me beyond belief. Realistically, if you're trying to rehab particularly a lower back injury, you have to be willing to accept an uncomfortable truth. And that uncomfortable truth is, as bad as the injury may be, is that you're responsible for how your back feels at any given moment, depending upon how you've been using it in the previous moments. So, sometimes that can sound quite flippant because it sounds like basically I'm saying, you deserve your back pain. Well, yes and no, depending on what's going on. But realistically, 99% of the time, you can always, I've even had people that have had horrific accidents where they've been, smacked by tree logs and motorcycle accidents and all the rest of it. Even them, I would say to them the same thing. You've had a bad accident, but you're 100% in charge of how your back's feeling at any given time, and you can always improve it. You might not get to 100% straight off the bat, but you can certainly dull the pain and make it feel better by doing the right things and avoiding the things you shouldn't do. So grasping that uncomfortable truth that you are responsible for how your back feels, although it sounds quite flippant, like I said at first, it's actually quite empowering, because you start to realize that because your back is always doing something, again, it's always holding you up or holding you together, it's only responding to how you use it. So, if you identify and remove your pain triggers, straight away you're going to feel less back pain. If you understand the mechanics of your injury and then use that understanding to develop a sensible rehabilitation program to work on your weaknesses, you're going to make your back stronger and more robust. And always when we summarize things, we have two lists for any given back injury. One is a list of bad habits and postures you need to avoid, because that sensitizes the back to pain and depletes your bank balance. The other list on the second side is the things that you need to continually do that help build strength and robustness. So like the wise and powerful, Dr. Angela Locke said, back pain is not forever, but exercise is. So, I always say to people, a bit of a joke, but it's all in all seriousness, I say to people, the main goal of working with me is at the end of the program, the most important thing is you understand those two lists for you. So you understand all the things you need to avoid and reduce in terms of bad postures and movements that aggravate the back. You also know the things that you need to do almost religiously, but at least consistently, that keep the back in check and keep things strong. So usually it might be things like hip exercises and core exercises, for example, that keep everything well tuned, keep it humming along nicely, and keep the back strong and robust, and again keep that bank balance as maintain it as big as we can. See all the things you want to do. So I say to people on that understanding, if we finish up working with each other and then a year after that you send me an email, give me a call and say, hey Brian, my back's bad, my first answer is going to be, well, you deserve it, because and I know certainly that you haven't been adhering to those two lists. So you've either been doing the stuff that you shouldn't have been doing, which has caused pain, or you haven't been doing enough of the things that help keep the back in good order, or maybe a bit of both. So again, successful back pain rehabilitation starts with accepting an uncomfortable truth, and that is you are responsible for how your back feels. And the reasons why it feels bad might not be immediately obvious, but they will be there, but they require a bit of investigation. But you have to accept the fact that you are responsible for how it feels. But the trade-off is that if you accept that responsibility, you suddenly become empowered in knowing that you're in control of how your back's going to feel at any given moment. And again, it won't be 100% all of the time, but you should certainly really keep it in the 90 to 100% range just by following those two lists. And if it does start to get low, you need to kind of get back onto those two lists and readdress that balance a little bit more. So again, most important thing, or the biggest secret I can say, is accepting the uncomfortable truth that you're responsible at any given moment as to how your back feels, whether it's good or whether it's bad, because your back only responds to how you choose to use it.